Hi, this is Teresa Pavlos, editor-in-chief of Dr. Bicuspid. I am with Tom Viola, pharmacologist extraordinaire, once again for another episode of Dental Dose. Today, we're going to be talking about COVID-19 vaccines.
Oh, yeah.
Very timely.
Absolutely. A lot to talk about.
So before we dive into it, I think you just wanted upfront, Tom, you said, if I remember correctly, to give a disclaimer that this content ages very quickly. Can you tell us a little bit more about that?
Yeah, the life cycle on news that regarding COVID-19 is so short that sometimes I'll record a podcast or a webcast like this, and a day or two later, I'm finding out that what I said was either not completely right, 100% wrong, or today it's right, but tomorrow it might be right again. So I have no idea. So that's the disclaimer. Yes.
Disclaimer: we're recording this on April 6th. As of an hour from now, it may be outdated, but hopefully you'll still have some important information that you can take away. Perfect. And so our topic is kind of on acetaminophen, ibuprofen around vaccination time, and what dentists need to know. Most dentists are vaccinated at this point, but what they can tell their patients if patients have questions and things like that. So take it away, Tom. I'm really curious to learn. Very practical here.
Thank you. This is a dental dose of the day for sure, because it's so timely. I will say that a lot of dentists, as you said, are vaccinated. A lot of hygienists and dental assistants are also vaccinated, which is great for us, great for our patients. But we've all heard, right? Yes, we've all heard that unfortunately, usually the second dose, but sometimes the first dose of the vaccine can really cause issues for folks like fever, chills, body aches, pains, just a whole assortment of side effects from the vaccine. Again, typically dose 2, sometimes dose 1. With the J&J vaccine being 1 dose, it's hard to say, if they ever feel a symptom at all. But if they did, I'm sure it'd be much along the same lines. Now, the point of all that is that's how vaccines work, right? Vaccines work by eliciting an immune response. So you want your immune system to be on high gear, right? So that when you get that vaccination, your immune system is reading and writing and learning, okay? And say, okay, this is what I have to be on the lookout for to destroy, okay? Which is all wonderful. And therein lies the problem, because we have these symptoms, headache, fever, chills, malaise. And so we've been conditioned over the course of time, me too, full disclosure, right? I'm the pharmacist, but I'm the first one to pop a pill if anything ails me, right? So we've been conditioned over time that when we have those symptoms, take a pill. Right? So you get a fever, take Tylenol. You get body aches and pains, take ibuprofen. Makes sense. But again, as of today, the thought process is by taking those medications on or around the vaccine administration, you can actually lower the immune response. You can actually sort of make the vaccination work a little less than optimal. So in other words, you don't get as much bang for your buck out of the vaccine as you would have if you hadn't taken those medications.
Yeah. And so it's interesting. My parents yesterday got their first dose of the vaccine, and my mom is having those flu-like symptoms. And I was like, oh, did you take some ibuprofen? And she said, no, her doctor told her not to. So she has the better advice than I did. And her doctor advised waiting a day before taking them. Would you second that?
At least a day, but again, the life cycle of this stuff is so short. Some people say a week now, some people say 10 days, some people say don't do it at all. Some people say, it's fine, the same day. The general consensus is you should wait a couple days, maybe 4 days to a week. But that's an awful long time to suffer with symptoms. And on the one hand, on the other hand, your symptoms might be gone by the 4th day. So, maybe it wasn't even worth it to wait to begin with. But the point is, I see that's definitely something we need to worry about in dentistry from that perspective. But what really troubles me is the other perspective, which is we prescribe these same medications to treat dental pain. So what if somebody, gets their vaccination, right? 2 days later or a day later, they're in our offices and they're there to get some dental work done, and there's going to be some pain afterwards. So what does the dentist, the hygienist, or the assistant, whoever's in the room with them, what is their recommendation to treat pain at that point? Should we advise our patients to take ibuprofen and acetaminophen, which is our favorite pair, right? We love ibuprofen and acetaminophen to treat dental pain. Are
Yep.
we going to advise them to take those and maybe make their vaccination work less than optimally? Or should we tell them not to take it so the vaccine will work well, but then their pain's not completely handled? So it's really a catch-22 for everyone in dentistry.
It sounds like you might have to then really listen to the patient and their needs and kind of make a case by case call.
No question about it. It's another reason or another good reason to reach out to our medical partners and say, this patient just got their vaccination the other day. They're coming in for dental work today. I know there's going to be some post-operative pain. What do you suggest? I know we don't have time every time we treat a patient to reach out to our partner and on the medical side and get a consult. But in this case, it just might be warranted because there's so much we don't know about COVID-19 and vaccinations and the responses that maybe at least get a general consensus amongst the docs that you normally deal with on the medical side and see what they have to say about the whole thing.
That makes sense. And it seems like, again, the acetaminophen, ibuprofen is going to be the thing that dentists are probably most coming up with their patients. Is there anything else just high level that dentists should be aware of in patients that may have gotten a vaccine recently in their practice?
At this point, remember that their immune system is on high gear. So they very well could do well as far as, handling post-operative infection, that sort of thing. Maybe they wouldn't get infected at all. I would caution one thing though, and this is important, I think, for our high level discussion, and that is dentists and hygienists and assistants who take medical histories can easily glean some quick facts. And one of them is patients who take medications like Humira, or as a matter of fact, this week it came out that Remicade was implicated in this. These drugs are used to treat autoimmune disease. So their very nature is to squash immune response. And yet that's in direct contrast to what we'd expect from someone who just received the vaccine. We want them to have high, immune function. So keep that in mind if you've got a patient who is on these medications and in the past maybe it has been somewhat immunosuppressed and more likely to have infections. Perhaps make sure that they're aware that they should be talking to their doctor about getting the vaccination done around their scheduled, administration of those drugs.
That makes sense. Just trying to be another resource for patients when it comes to the COVID-19 vaccines.
Agreed. Yeah, absolutely.
Perfect. Well, thank you so much for speaking with me about vaccines today. Once again, for those of you watching at home, we're recording this on April 6th, so hopefully that is still relevant, but there's that little disclaimer for you.
Thanks a lot, Therese. I appreciate it. Thank you.